Dr. Scott Talpey's presentation, our senior lecturer for tonight. He's a program coordinator with Strength and Conditioning with Federation University Australia. And today with him, he has Russ Rainey, and they're going to be presenting Developing Agility for Rugby, Implications for Performance and Injury Prevention. So Dr. Talpey, you want to share your screen, please?
Excellent. Thank you very much. Let me just share. And then call up. There it is. All right. Can everybody see my screen? Yep.
Yeah, I can. Yeah.
Yeah. Well, Dr. Lopez and everyone else, thank you for inviting me today. I think this is a pretty cool opportunity for me. And I'd also like to introduce Russ as well. So Russ is currently a lecturer in New Zealand, and he's just completed his PhD with us here at Federation University in Australia, so he can add some interesting insights as well. All right, and as I go, and any sort of teaching that I do, I don't like the term lecture, so please feel free to just unmute yourself and ask a question if you want along the way. A little bit of extra background, you may notice that whilst I'm currently in Australia, I am not an Australian. I am from Connecticut. I grew up there. I went to my undergraduate degrees from Springfield College in coaching and physical education, where I actually played rugby for 3 years at Springfield. I then taught and coached for several years, and then I transitioned into the area of performance. Well, I did my master's degree at Southern Connecticut State University in human performance. I then moved over here to do a PhD in strength and conditioning and sports science, where after I finished that, I worked with the Australian Centre for Research into Injury in Sports and its prevention as a postdoctoral research fellow. So as I mentioned before, I am not an epidemiologist by any way, but what I would do is work alongside, I don't know if you're familiar with Caroline Finch and her work, and Lauren Fordington, who's done a lot of work in injury prevention in rugby. And my job was to try and translate the injury prevention messages from their research to coaches, because ultimately the coaches make the decision on the training that's done for the athletes in that session. So being able to speak the language and translate the epidemiological research and the terminology that they use and translate it into a context that is more familiar to the coach, so they're more likely to buy in and implement these sorts of strategies. And that's where I kind of fit into this injury prevention area. So we'll just go from there. So an overview of this session, I want to start off because we use the term physical preparation coach over here because that's an all-encompassing word. In the United States, I know that strength and conditioning is the popular term, but strength and conditioning gives the connotation that an individual like myself just lives in the weight room and all we're concerned about is performance. But if we use the term physical preparation, that encompasses the prevention of injuries, because ultimately an athlete's greatest ability is their availability. If an athlete is big, fast, and strong, but they can't play because they're hurt, then their speed and their strength and their power doesn't help us in what we're trying to do. So I want to talk a little bit about where we fit in the injury prevention process. And then we're going to talk about what agility is and how its development fits within the injury prevention process specifically for rugby. And this is where Russ, my colleague, will be able to add some insight from his PhD work in Australian rules football. And then what we're going to do is discuss and add some ideas and recommendations for agility development specifically for rugby. Now, it would be totally inappropriate of me if I didn't mention two people because they really, we've discussed this for many years. So Warren Young is a mentor of mine and was Russ's PhD supervisor along myself, and he with myself, and he's produced about 20 years of agility-based research, and we work very closely with him. So a lot of the information that I'm going to present today, I've literally just stolen from his mind. And then also we work closely with Shane Lehane, who's the head of strength and conditioning for the Melbourne Rebels in Super Rugby, and he helps really provide that rugby-specific context to what we talk about. Unfortunately, neither of them could make our discussion today. Due to the COVID crisis, Melbourne Super Rugby in Australia is about to start up this weekend, and Shane had to relocate cities so they can have a bit of a hub to start out. So he's unable to join, but he's helped a lot in this development. So if we look at our first question that I want to kind of discuss, and it's where does the physical preparation coach fit in the injury prevention process? And there's a lot of injury prevention frameworks out there. You have the Van Mechelen model, which is the 4-step process. You have Caroline Finch's TRIP model, which is a 6-step process that really ties in the implementation. But both of those are very research-based. And I know that we are academics at heart, and we are looking at research. But if we want our injury prevention practices to have a real-world impact, then we need to understand where they're going to be applied. So I actually like to use this injury prevention model here that was published last year in the Journal of Science and Medicine in Football by James O'Brien, who was a PhD student here at Federation University with Caroline Finch. And it's the injury prevention in team sports. So the TIP model, team sport injury prevention cycle. And what this tries to encompass is that injury prevention is not always driven by a researcher. It doesn't always have a research outcome. So in a team sport environment, we all work as part of a multidisciplinary team that's with the goal to improve the performance and safety of the athlete. Now, as a physical preparation coach, our underpinning philosophy is athlete-centered. So it's not about coaching our method or coaching our program. It's about helping that athlete in what we, in their goals and their endeavors. And that aligns perfectly with injury prevention. So what the team sport injury prevention cycle does is looks at what is the current injury situation, what is the current injury prevention situation, so what are we doing to mitigate the risk of that injury occurring at a team level, what are the risk factors and mechanisms associated with that injury, and then within our club and our organization, what are the barriers and facilitators to delivering that injury prevention program. We then need to plan the content, deliver it, and then reintroduce those strategies once we collect more information. Now, I apologize if this is something that you've discussed before, but this is in our Masters of Strength and Conditioning program, a large component is focused on injury prevention. And I know in the US you have athletic trainers. Athletic trainers are not a profession over here. That's not something we have. It often falls to the physiotherapist, and the strength and conditioning coach plays a large process in that. So what I want to do is kind of present you with a hypothetical situation of what this might look like implementing or following this TIP model or this TIP cycle in a rugby-based situation. So what we have here, if you look at the picture, we might have a knee-related injury in a female rugby player. So we look at what is the current injury situation? Well, we may find that the incidence of knee injuries in women's participants along a talent development pathway, so these are our talent identified juniors, into 7s and 15s competitions has increased. So we're seeing a lot more knee injuries in this specific athlete cohort. So what is the current injury prevention situation? Well, we bring people together, and what they might find is that the sports medicine and the sports science staff is they've placed a large priority specifically on the development of strength and power, because their philosophy is underpinned by the importance of that for rugby, which may be the case. We know that stronger players and more powerful players are often more successful in rugby. So we bring everybody together and we have a meeting. So this is the coaching staff, the performance staff, the sports medicine staff. So there's 3 factors that may be identified for this increased incidence of knee injuries in rugby. One, well, we find that the injuries are primarily within a specific position or groups of athletes within our organization. When we bring everybody together, so we have the physical preparation or the strength and conditioning staff at your more elite level, and we also have those developmental strength and conditioning coaches that work with our younger athletes. And what we might find from this meeting is that there's a difference in philosophies between the junior athletes, or sorry, the coaches of the junior athletes and the coaches of the senior athletes. So they're malaligned. And we may also find that the affected players have had a history of previous knee-related injuries. Well, from there, we need to understand what these barriers and facilitators are for us to deliver a injury prevention program. So a barrier, a common barrier to injury prevention in any team sport is a perceived lack of time to implement additional injury prevention measures. And there may also be a lack of willingness of that physical preparation or strength and conditioning coach to kind of change their training philosophy. So what we see and what we may do once we understand those barriers is plan how we're going to change and what we're going to do differently. So we may begin to implement more hamstring strengthening exercises and plyometric training exercises, because what resulted from our meeting may be that we're focusing solely on Olympic weightlifting for power development, or your traditional squatting and deadlifting, which we're negating our hamstrings, which play an important role in ACL injury prevention. And then, which links to what we're going to talk about later, our sports medicine and our sports science staff at our more senior levels, we agree to align our training philosophies by incorporating more true agility scenarios rather than having everything be more pre-planned. So this is an important, if we're going to talk about injury prevention and understanding that it's multidisciplinary, we kind of need to understand every different discipline's perspective on injury prevention. Another area that a physical preparation coach can influence injury prevention, if we know that one of the largest risk factors for an injury is that that injury has occurred before and a poor rehabilitation process. So once again, I'm sorry if this is something you've discussed previously, but if we look at this control to chaos continuum that was published in BJSM last year as well, where we look at progressing the rehabilitation from an injury, from being in a highly controlled environment and progressing it into something that's more rugby and more sport related, because sport, and specifically rugby, is extremely chaotic. And if the rehab is dominated by this high control and not a lot of decision making and high-speed running demands, then we're not adequately preparing that athlete to return to sport, and ultimately their risk of re-injury will be higher. So we like to look at it this way. So early on in the rehabilitation process, it is primarily sports medicine driven, with a little bit of influence from your strength and conditioning or your physical preparation, people who are performance minded. But as we progress up through this continuum to add more chaos, the influence of that physical preparation coach is going to drive it, because inherently, due to what we do in our role, we understand the demands of sports in that chaotic sort of environment. So it's about working together, and some disciplines taking more ownership at certain times than others. And this is a nice little paper written by Shane, who I mentioned earlier on, that was published in the Journal of Australian Strength and Conditioning, where he outlines a rehabilitation program using this control to chaos continuum in a professional rugby athlete. And what links to what we're going to talk about now in agility is understanding the difference between what we term change of direction speed, which is pre-planned agility in nature where there's no decision-making component, to true agility where someone has to change their movement patterns in response to a stimulus in their environment. And if what Shane outlines in his paper is, if you're in your chaos environment and you're about to return to play, but your agility type training is all pre-planned in nature, you haven't truly added enough chaos for them to return to performance. So, which brings me to our second question we want to address. If we look at all of those together, agility is an important topic for prevention and the mitigation of injury, as well as performance. So if we look at the accepted definition of agility in sports science-based literature, it's a rapid and accurate whole body movement with a change of velocity or direction in response to a stimulus. And this was put out by Jeremy Shepard and Warren Young, who I spoke about earlier, in 2006. And just to evidence that it's the accepted definition, is this has been cited, over 1,300 times within the literature. Now, to put a more rugby-specific twist to it, if we look at BoxSmart, which is the injury prevention exercise program that some of you had mentioned in your journal review, this is the definition of agility presented in BoxSmart. So agility is commonly defined as an effective and quick coupling of braking, changing directions, and accelerating while maintaining motor control in either a vertical or horizontal direction. And this is directly from the BoxSmart Physical Conditioning for Rugby as an evidence-based lit review. This is on page 7 of the document. And what we notice here in this definition that they use is there's no mention of having to make a decision and responding to that stimulus. And that stimulus could be a defender in front of you, it could be an attacking player in front of you, but that ultimately determines the movement strategy that the athlete is going to take in competition or in training. So as I mentioned before, the definition in BoxSmart more aligns with change of direction speed, which is pre-planned with no decision-making stimulus, and ultimately is less related to game-based situations. So if we're using this pre-planned definition of agility to inform our injury prevention practices, are we, I think the question needs to be asked is, if we're really truly performing or preparing someone to move appropriately for competition. Now, this is change of direction speed is commonly used in these sorts of injury prevention exercise programs because it's easy to program and assess. But Russ and I will discuss later, and you feel free to ask questions, but it's highly debatable whether change of direction training, running around cones, running, doing agility-based ladders actually improves any aspect of performance at all. So it's important to understand that change of direction speed and agility are not synonymous with each other. Agility is an open skill and change of direction speed is a closed skill. And sport is open. We are constantly changing our movements based upon a stimulus. So agility is inherently more related to sport than running around cones and your change of direction speed based training. So if we take a bit of a deeper look at agility and what underpins important agility performance from a physical quality standpoint. So this is a paper that Warren Young, Ian Miller, who was an honor student of ours a few years back, and myself published in 2015. And what we had these participants do is both a change of direction speed task and then an agility task where they had to react to a sport-specific stimulus. And what we found is that the relative contribution of physical quality, so strength, speed, and power, differs between the change of direction performance in the change of direction task and in the true agility task. And basically, only 14% of agility performance was explained by physical qualities. So that's the strength, speed, and power. Just highlighting that if we want someone to be agile, then we need to really focus on their decision-making and their perceptual cognitive demands of it. And this was also supported by a paper studied by Tanya Spiteri, also from Australia a few years back, where she found that agility performance didn't correlate with any sort of measure of strength. So simply thinking that improving someone's strength is going to make them more agile is potentially not true. So if we want to focus a little bit more on agility and that quality of making accurate decisions, we need to look at reaction times. So this was a study that was published in 2005 by Damien Farrow, who is an international expert in the area of skill acquisition. And this doesn't relate, this is done in netball, which those of you in the US might not be familiar with netball. I surely wasn't when I moved over, before I moved over here. But netball is similar to basketball, except there's no dribbling in it. And it's primarily a female sport. And what they did is have a test where the athlete had to react to a stimulus that was presented, a visual stimulus that was presented on the screen of someone passing a ball. They then had to observe what was happening on the screen and then sprint through sets of timing lights. And what they found is that your higher skilled athletes, so those that compete at a national level, actually started their movements before the stimulus was even presented on the screen. Whereas lesser skilled players who compete at what we would call a state level, they were still able to anticipate what was going to happen before that pass was even shown on the screen. And then your lesser skilled players, just your local level out there having fun, they had to wait before to see that stimulus actually presented on the screen before they started their movement. And what does this mean, or why does this happen? It means that higher level players look and extract different cues from the environment to anticipate an opponent's actions. So they know what's going to happen before it even occurs because they can pick up on information in that athlete's body movement. But it's also important to notice and discuss that this stimulus that they react to has to be sport specific. So you see a lot of agility-based tests or training that use flashing lights. Those sorts, whilst they require someone to react to a visual stimulus, because it's not sport specific and you're not presenting the athlete with any sort of specific cues, there's no pattern recognition and recall. So you're not actually training that decision-making component as it would occur specific in sport. So that's kind of a bit of discussion around agility and its underpinning physical qualities as well as the cognitive qualities that influence it. Now, if we take a look at something that may be more specific or resonate more from an injury prevention standpoint, let's look at the knee. And this was a systematic review published, I believe, don't have the year up there, but I believe it was 2014, where they looked at how knee mechanics change during a planned, so a change of direction-based task, and an unplanned sidestepping action. So a sidestep is widely regarded in injury prevention for team invasion-based team sports as a mechanism for ACL-related injuries. But a lot of injury prevention programs focus on pre-planned movements. But if the knee acts differently when you have to react to a stimulus, what's the transfer from those injury prevention programs to actual training and performance? So what this study found here is that there were moderately large knee angles, moderately large differences in the knee angles observed in planned versus unplanned sidestepping. So that's what we see right here. So knee angles are different, and people perform a sidestep differently when it's pre-planned and they have time to adjust their footwork and time to produce as much force as they possibly can in that sidestep to then push off and change directions. Whereas in a reaction-based, you don't have that time availability to produce that force and adjust your steps accordingly. So if all agility prevention is quote unquote if all injury prevention agility tasks are pre-planned, we then need to consider, are we leaving the knee underprotected for injuries in these sports? So I use the term IPEPs. I don't know if that's commonly used in your group, but injury prevention exercise programs should then provide opportunities for the athlete to react to game-like stimuli. And if you look at the Box Smart program and their Safe 6 exercises that they've put out, you'll notice that those are primarily pre-planned changes of direction as well. And you couple that with their definition of agility that they use in their physical preparation handbook. You know, maybe consider using some more reactive based agility stimuli in those programs. Now, as a lot of you just mentioned in your journal club discussions, the tackle is the most high risk situation in rugby. It's where injuries occur. And if we look at a tackle, you know, the purpose of agility from an offensive standpoint is primarily to evade the tackle. So if we can develop agility in players and help them evade that high risk situation, inherently there is potential that we could reduce the risk of injury occurrence in these collision-based sports. And understanding that often these situations occur where a tackle can't be completely avoided, but maybe we could be evasive enough to lessen the contact or the ability of the defender to, collide with us as forcefully as possible. So, and when we look at what we just discussed with agility, the tackle in preparation to execute or evade a tackle, as I said, they're high risk activities. And a tackle by nature is an extremely chaotic and unpredictable event that is a key component of the sports. Now, if we want to completely, you know, reduce the risk of injury, then, you know, you can't take the tackle out because it's part of the sport and then you're not playing rugby. So, you know, we need to find other ways to mitigate that risk of injury and lessen the risk-related nature of the tackle. And developing agility could be one of them. And when we look at what happens in a tackle, it requires the athlete to coordinate an accurate movement in response to information presented to them in a dynamic, open environment. So tackling is an agility-based event. And the incorrect movements or the correct movement executed too slowly may place that athlete in a compromised situation that may increase injury risk. So I guess a question I've looked for research, and I mentioned earlier an article by Tim Gabbett in 2008, where he also looked at tackling technique and how that changes with fatigue. And he looked at agility, but when you dive deeper into his methodology, he actually used a change of direction test. So when he looked at tackling technique, he didn't relate it to a true measure of agility. He measured change of direction speed. So there wasn't any sort of measurement of reaction to a stimulus. It was all how quickly can they run around a pre-planned course. So taking a bit of a deeper look at what actually happens in a tackle and dissecting it a bit from an agility standpoint, is we have here in yellow our attacker or our offensive player. So this attacker, some things that may be going through her mind in a split second could be, should I take her on? So should I take on the defender and try to evade her? Should I fake a pass, or should I try to run right through this individual and collide with her? She also has to consider which way is this defender moving, and then we can see she could be looking into space to try and find an open space and then attack that open space for her evasion maneuver. Then from the defender standpoint, she's thinking to herself, all right, I have to make a tackle or I have to try and corral this offensive player. What part of the body should I be focusing on? She also needs to be aware of her teammates. So does she have help? Where can she just stand this offensive player up and hold her up and let a teammate come in and help finish off the tackle? Is this individual going to perform an actual evasive maneuver? Is she going to try and fake and try to figure out which way she can go? And all of these decisions happen instantaneously, which if we're just running around cones and doing fast feet ladders and things like that, we're not actually training this in any way, shape, or form. So this is where we come to our next bit. So if we want to improve agility performance and potentially improve safety, because I don't see yet, I can't find many studies that have looked at it from an injury prevention standpoint, but how do we train agility and how do we assess it and how do we test it? And this was the crux of Russ's PhD. So Russ, please feel free to jump in at any point in time if I give you an opportunity to. So one way we train agility is through small-sided games. And what a small-sided game is, where we manipulate what we would call the constraints of an activity, or really the rules is an easy way to look at it, to elicit an agility concentrated stimulus. So creating an environment where the athlete is forced to make tackles in a chaotic but yet still somewhat controlled environment, or the person with the ball has to try and evade a defender in a somewhat controlled but still chaotic environment. So ways we can do that is we can change the size of the pitch and the number of players in that area. And that's a term that we describe, we use player density. So the number of players divided by the area of the pitch. So if you have more players in less space, then more decisions are going to be made. We can then manipulate the rules of the game. So in small-sided games, there's often a scoring system, or the sort of rules. You can have them, they have to try and evade. So if a ball carrier has, if they're coming into a tackle-based situation, they can't run through that individual. They have to try and evade, or they can't give the ball off immediately. They have to try and put a maneuver on the defender to get around them. And lastly, something that could be done is awarding points. So, a point system or scoring for these activities, you could give teams points based upon whether or not they actually evaded or attempted to corral safely. Other ways that we can do it are in 1v1 sort of scenarios. Which are common drills in collision-based sports like American football, Australian football, and rugby league, rugby union, and sevens. But there's pros and cons to using a 1v1 based situation as opposed to a small-sided game. Yes, both require the athlete to take in information from the environment to inform their decision-making and ultimately their movement. Both require anticipation, which we know is important. But in a 1v1 situation, the pattern recognition and the prediction is not as specific to game-based scenarios. So in games, it's not just you versus someone else. There's other people, other athletes involved in that scenario that influence ultimately the movement outcome. So this is a test that Warren Young developed a few years back and published in 2017 in the Journal of Strength and Conditioning Research. And Russ has actually modified this for his PhD. I'll play the video for you, but Russ, after I'm done playing the video, if you want to kind of describe what happens. So hopefully you can see this when I play it. Oh, hold on. If someone could just tell me if you were able to see that video?
Yes.
Yeah, great. So Russ, you want to kind of explain this test that you used in your PhD?
Yeah, so we were looking to try and find an ecologically valid measure of agility. So a measure of agility that represented what actually happens in 1v1 scenarios in team-based sport. And so we had a ball carrier holding an Aussie rules football, trying to get past a defender and get past an end line in this case. And then that's later been modified with some time restrictions so that the player actually has to take on the opponent. So while we were looking at it through the lens of Australian rules football, I think it's potentially maybe closer to rugby, or at least close to rugby, in that you have one player specifically having to get past another player, where there's an kind of an offensive line and a defensive line, which doesn't happen in our sport of Aussie rules, but it does happen in rugby. So the test was scored on the ability for the attacker to evade the defender, and the ability of the defender to get close to a attacker and potentially tackle. So by doing that, we were able to differentiate the difference between attackers and defenders, and you can see the scoring criteria at the bottom. An attacker would get a maximum score if he defeated the defender without getting touched. And then if the defender got one hand on the attacker gets a lesser score, the defender gets a higher score, all the way up to if a defender tackles an attacker all the way, then the attacker was obviously unsuccessful in that agility scenario, so the attacker gets a score of 0 and the defender gets a score of 3. And to try and add some variability that you'd see in the game, the starting positions of the attacker and defender change multiple times over 10 trials, to try and capture that variability.
Great, thanks, Russ. So and another thing that's I think is important when we look at this from a sport-based scenario is a lot of change of direction speed tests are focused on how quickly you can execute maneuvers around a course. But in the sport-based scenario, it's can you get past the defender or can you tackle the attacker? So this test is based upon an outcome rather than time, which is more related to what we see in sports. As Russ mentioned, there's a variety of different movement strategies. So we observe people using side steps, split steps, or spin moves to try and evade. So, and that's similar to what we may see in sport rather than strictly just a sidestep movement. As Russ mentioned too, this test has been adapted for rugby and was published by Drake in 2017. There are some limitations to it. One, if you're going to run this as a test, you need to have the same testers. So the attacker always has to be the same person for the defender, or the defender always has to be the same person for the attacker, just for consistency of measurements, which makes it somewhat difficult to run. And whilst it's a step in the right way, it's not as complex as a game because it is only 1v1. Now, this is, I just want to say, I probably should have stated it at the beginning. In our Masters of Strength and Conditioning program, this is something, when we talk about agility, we spend probably six hours going into really, really big or in-depth detail on it. So to summarize it in 40 minutes, we've been a bit superficial. There's a lot of other areas of it that can be expanded upon a bit more. But in, I guess, conclusion of everything I've presented today, really, from an injury prevention process, in the US, the athletic trainer plays a large role in that. And being someone who is taught in the US, worked in the US college system, worked in the US high school system, the athletic trainer is an extremely valuable individual. And being over here in Australia, not having an athletic trainer makes things for myself pretty difficult at times. I always wish we would have that athletic trainer available to us. And understanding that some of you in this discussion may have athletic training backgrounds, I 100% value your role. But also understand that from a strength and conditioning or physical preparation standpoint, a good strength and conditioning coach should be able to help you in your tasks and your job. And similarly, I think a quality athletic trainer should be able to work with the strength and conditioning coach. There's a lot of, often the athletic training room and the weight room are separated by a wall, but it seems like that wall is a mile thick. I think that wall needs to be broken down, and everybody needs to come together and really work to help improve safety and not just performance. From there, agility is an important component for performance as well as safety. And I spoke about it from a tackling standpoint, and some of you talked about tackling technique in your journal reviews. But when we look at tackling technique, I think maybe there's scope for additional research to look at agility performance requiring that decision making and how that influences technique. And I think they're inherently related to each other. And when we train it, it's really about exposing athletes to situations that they're going to see in a game, and then helping them execute movements based upon game-like situations. So I really thank you, Dr. Lopez, for the opportunity. I was working over in the US a few years ago, and Dr. Lopez and I were trying to coordinate a meeting that didn't happen. It just so happens now we can do it via online methods while I'm on the other side of the world. So thank you again for this opportunity.
Well, thank you both for joining us. And again, please do speak to Shane and let him know that we'd love to hear from him in the future. And again, I do have to agree with you. I know we've tried to correlate times to you to come or work together in some capacity, and we were very busy. And again, busy is good at the time, you know. I think what happens is that we have this downtime now to really reach out to people that we've wanted to reach out to really correlate, maybe discuss different ideas and topics. And again, we found your topic extremely interesting, and glad that you were able to share that with us as well as with our listeners. All right.
Nope. Had questions or anything?
Yes. Thanks, Russell, for your time. And I understand you got to go to a meeting. Again, appreciate your time.
Thank you. Thanks for having me.
Not at all. Do we have any questions? We'll start working our way up. Ruth or Lily or Megan, Akira? Go ahead.
Oh, I just had a quick question. Could you elaborate on what your thoughts are on ability in relation to mental fatigue in the athletes?
Yeah, so I think it's important that I use, when we talk about understanding the demands of a game and understanding the demands of a sport so that athlete can be physically prepared to cope with them, it's important that that athlete is able to be prepared for the worst case scenario. So if that athlete can't handle the worst thing that's put in front of them, then their risk of injury and their performance is compromised. So factoring in fatigue, whether that be mental fatigue or physical fatigue, and they're inherent in sport, they're related to each other, is extremely important. So when we talk about being able to execute a movement while tired, and having played, albeit not at a high level, and we weren't very good, but played rugby for 3 years and played American football for 12. If you're put in a situation where you have to make a tackle, then get back up, make another tackle, and you have to perform and execute 5 high-intensity collisions in a row, there's a physical fatigue as well as a mental fatigue associated with that. And if we don't incorporate training practices that help that athlete cope with them, then we're not doing our job as physical preparation coaches or injury prevention specialists.
All right, thank you.
I hope that answers your question a bit.
Yeah, definitely.
Thank you.
I also have a question, I guess, based more so on your own personal experiences. When you're trying to best understand and treat injuries in athletes, especially at really high elite levels, how do you go about athletes not wanting to report pain or injury or recurrence and stuff out of fear of being put out of play? And as an athletic trainer or strength and conditioning coach, what are the ways that those people can best go about kind of navigating athletes that want to be able to keep doing what they love to do, but also knowing that, you know, they need to take care of their health and such.
Yeah, so at an elite level, I think part of it is that athlete understands that's their profession, that's their livelihood. So they need to take care of their body as best they can so they can continue to do their job. You know, just like myself, if I'm going to be a good, you know, a good academic and a good teacher to my students, you know, I need to do these things and communicate with you so I'm constantly on the cutting edge of information. But from a sub-elite standpoint, and actually I shouldn't even say just from a sub-elite, in any sporting context, knowing your athlete is the most important thing. You know, so Tiffany, if you're an athlete that I've worked with for many years, you know, and I know that, you know, you love to train and you always show up for practice and you're in the right mindset and you're ready to go, you always want to get better. But then one day you show up and I just in our conversations with you, I noticed that you don't have that same vigor, that approach. You know, I know that you're hiding something or that there's some information that's, you know, is gonna negatively impact your ability to train. Maybe an injury, it may be mental fatigue, it may be something completely not involved or not associated with sport. I need to then adjust my training accordingly. So having that relationship with the athlete so they feel comfortable. You know, they feel comfortable telling me that they're not 100% and understanding that it's not going to be negatively held against them in any way, shape, or form. Flip side of that, though, is we've all dealt with this, is that athlete who's always hurt and never wants to train. And, you know, understanding that sometimes you've got to say, listen, today you just got to go out and do it and kind of push them a little bit more. So when it comes to athletes reporting injuries, my opinion and my thought is the biggest thing is they have to have a good relationship with their coach so they feel comfortable doing it.
Thank you. That's really helpful.
Thanks, Tiffany.
Hi, I also have a question. So my question is, have you found any studies, especially regarding concussions, because sports like rugby and football are like high impact sports. So are there any studies out there that you've seen regarding concussion and agility, or like are there any tests that physicians perform for athletes that are coming out of concussions or any head injuries to test their agility to see if it's like decreased or not?
Yeah, so that's a very interesting question, and I actually reviewed a paper years back because if we look at it from a rehabilitation from a concussion, and I'm not a rehabilitation expert in any way, shape, or form. I'm not qualified to oversee a rehabilitation program because I'm not an athletic trainer over here. I'm not a physiotherapist, but that's in that return to play, we need to put them in that environment where they have to make decisions. So there needs to be that dual task cognitive components coupled with the change of direction. And how you integrate that could be more of a generic stimulus at first. So using those sorts of progressing from a pre-planned change of direction task to a generic stimulus to a 1v1 situation. And then ultimately they have to make decisions in this complex, chaotic sort of environment. And I think progressively overloading, as a fundamental principle of any training program, progressively overloading that decision-making component or those cognitive demands would be extremely important from a return to play from a concussion standpoint. I don't know of any studies, though, off the top of my head that have investigated looking at a reactive-based agility test and return to play. Everything I've seen has been more generic-based stimulus or change of direction-based task. Good question. Hope I answered.
Thank you.
I have a question as well. I was curious with regard to agility drills in terms of their timing. Should agility drills be emphasized at certain time points in the season? So I'm a collegiate athlete, I play volleyball, and we tend to work or have more pre-planned sort of change of direction drills in our off season, which is happening right now, but we focus more on like in-game agility that isn't pre-planned during our season. And I'm curious as to if like it's better to do it one way or another, or if agility should be more emphasized at certain points in the season.
I think,
Dr.
well,
Talpey, Dr. Talpey,
yes.
before you comment on that, I wanted to find out, Samantha, in your volleyball program, are they doing the same?
Not really. Our coach mainly just makes us run a lot. We don't really focus on agility stuff as much.
Yeah, so it's interesting. And I think the change of direction component is extremely important in, I think, long-term athlete development. So early stages. So when you're a younger volleyball player, really looking at getting, the force production and the body positioning, correct, but understanding that that's not what it looks like in a game. I would say that throughout a periodized training program, so if you're in your what we would call a general prep phase right now in your off season, then I think you should still have your agility based tasks, and that would traditionally come from, in a normal environment, non-COVID related environment, that would come from playing like in a summer league. I don't know if that's something that you would typically do, but you'd get that sort of agility stimulus while playing summer league. But now you might not have access to other people to go play with. So having that general change of direction stimulus wouldn't be a bad thing at this point in time. But understanding that as you get closer to your game, you're going to have to increase the specificity of your training and add more agility-based work to it. Right now, if I was a volleyball strength and conditioning coach, I would be heavily on the plyometric training. So we'd be doing a lot of jumping, a lot of plyos with shorter contact times, which is important from a knee injury prevention standpoint. But then understanding, once you get more closer to your games and your competition, your jumping on court is going to go up. So your jumping in your training, your strength and conditioning based training has to go down. I hope that answers your question a bit.
Yes, that does. We actually are training during the summer months tends to have like plyometric jumping exercises right before we do agility. So we're doing a lot of jumping right now, as you sort of explained.
Awesome. Where do you play volleyball?
I play at Washington and Lee University. It's in Virginia.
Maryland, right? Is that Maryland?
It's in Lexington, Virginia.
All right. Samantha, where do you play volleyball?
I play at Kaiser University in Florida.
Cool. Oh, excellent. Are there any other questions?
Well, I'll just make a couple of points. If there are no questions, I just wanted to, I know Dr. Talpey covered so much. So I just want to highlight a couple of points, and that is, I know Dr. Talpey must be a very big advocate. They have a couple of studies out on the sports medicine team. Obviously, it's multifaceted. We're taking into consideration strength and conditioning coaches, even the sports psychologist. It's important to have that rounded capability of evaluating the athletes. And I think we did that, I guess we did a great job with the Northeast Olympic Development Academy, where we had something of 23 graduates go on to the national squad over the past 5 years in my tenure while I was there as the medical director. The unique thing about it is that we really tried bringing in everything you're saying, Dr. Talpey. We brought in as much knowledge, if not more so, that we couldn't even implement. It was so dynamic. We were moving at such a pace. Players were being pulled, and that's where the inconsistency became, where I think you alluded to your population that you've been looking at. Your developmental or your academy players. I don't know how you term on. Again, they term them very differently. Our national candidates, Olympic Development Academy players, what did you term them again, sir?
I think I said developmental pathway, talent identified
Developmental
pathway.
Correct.
Yeah.
So in that crux, yes, there are more resources than community play or even university play, but the problem is implementing them with compliance is really, I thought, a very big challenge. And
Yeah.
I think you really bring it home by saying you have to work with the coaches, because even though the coaches have the inaccessibility of the knowledge, they are the key to the players. And I think, Soligard's paper discussing compliance and injury prevention, approaching the players, approaching the team, and then approaching the staff. So you have to look at it in almost a threefold capacity of how you're almost reiterating your attempts to try to do the right thing for the players. And that's
That's
I think,
right.
and I think you brought it up right by saying it's a very, very important dynamic, having all those players or all those facets in sports injury prevention. I'm thinking you're seeing that more over there as well, right? The collaboration.
Oh, 100%. And that's, we developed, well, I guess I was a part of it. So I don't know if you've ever seen the Footy First Injury Prevention Exercise Program, which was designed to prevent injuries in non-elite Australian rules football. Because over here, and to explain the context a little bit more, we don't have high school sports. We don't have college, we don't have collegiate sport. So everything is really community-based and non-elite. But because
club-based, I guess that's the word, right?
Club-based. And because they don't have the resources, or they don't invest their money in resources to prevent injuries. So the coach is the driver of it. The coach is that one person who's at every training session. He's or she is the one that knows all the athletes. And there's no strength and conditioning coach. There's no athletic trainer. They might be some guy who's been around for a long time and likes to tape ankles, but he's not qualified. He or she's not qualified to do any sort of injury prevention work. They don't know what's good technique, what's poor technique. So getting to the coach and providing educational opportunities for the coach so they understand the importance of injury prevention, that's preventing and doing some sort of structured exercise program at the start of practice to mitigate the risk of a knee injury isn't going to take away from their training to improve performance. They all complement each other. There's an interesting, not to go off on too much of a tangent, but an interesting study a colleague of mine did over here is he videoed a bunch of non-elite coaches who would say that they don't have enough time to do these sorts of injury prevention practices. So he went out and interviewed them and video recorded their training sessions and then broke down the amount of time that coach spent talking. And basically what he found is that coach spoke and just talked for 33% of training times. So 30% of a practice was just spent with the coach talking. So he then went back to the coach and said, listen, you spoke for 1/3 of your practice session. If you just talk less and provide more opportunities to play, then you'll have more time to do these injury prevention practices. You're not actually time poor. You just perceive that you're time poor because you speak a lot, which is an interesting way to look at it.
It is. That's a very good point. I like that a lot. I think I've seen many of my coaches speak that long or longer, especially the ones from down under.
Yes.
Yes, my New Zealand coach for rugby was very verbose. But let me, a couple more points. I just wanted to bring in everyone, the IPEPs, as Dr. Talpey alluded to, they all deteriorate after implementation. I guess let me reiterate, that's also the compliance aspect. And I guess, Dr. Talpey, you could probably comment that once you try to implement this, they lose form.
Yes, they do. And there's been some good papers by Alex Donaldson. I don't know if you've reviewed any of his stuff.
I do know Dr. Donaldson, yes.
Do you? All right. So Alex and I have worked. Alex and I have worked together for a long time and have collaborated quite a bit. So if you look at
I met him at the IOC conference.
Great. So if you look at some of the work by Dr. Donaldson and Caroline Finch in the implementation of injury prevention exercise programs, that's exactly what they find is the coaching and the players are gung-ho at the start of doing it. And then after a few weeks, the compliance drops off. And once games start, once the competitive season starts, then they just get caught up in everything else. And then it's not a priority for them. So a lot of it is maintaining that emphasis of its importance throughout a season. Or they may do it once and then modify it and change that injury prevention exercise program, take bits and pieces of it to fit their own coaching style or their context that they coach in. There's a lot of
I'm sorry, that was something I was maybe going to allude to that we could discuss in the future about. The compliance maybe and maintaining. We'll talk further about that on another note. But one more point I wanted, or actually two more points I wanted to bring up, and that is, obviously, I'm sure you saw the two paradoxes in workload with Dr. Gabbett, right?
Yeah.
And one of his famous papers. But the more important thing is, there is no way to approximate match play in a rehabilitation program. And this is, I think, everyone here who's played a sport before, there's no way you can match the workload intensity that you encounter in a sport, and it doesn't matter what sport it is, in a rehabilitative or a controlled setting. So I think there is validity in what Dr. Talpey is saying about the chaos, your chaos theory in an implementation, and whether or not moving it towards more performance-driven, controlled, chaos, that's really what you want to do. And I think approximating match speeds, incidents, or the rates of tackles really is the only way to really bring in that back. And I think you'll agree with what I'm saying there, Dr. Talpey.
100%. I mean, there is no substitute for playing the game. As much as, and what we try to do though, as coaches, is try to make training as similar to a game as possible. And that relates back to rehabilitation, but you can't. You get into that game environment, your adrenaline is flowing, the intensity just rises in there that you can't simulate that in a practice or in a rehab. You've just got to do the best that you can to physically prepare them for when they do go in, that it's not, it's not going to be catastrophic for them.
We had a national coach for a country coach us, and he chose to implement the split field approach.
Yep.
And he would actually have multiple scrimmages with 5 squads, 5 smaller squads to approximate, play. And this way you would rotate each time you lost, or a new squad would rotate in. And I think that approach really made a big difference in our game. And I think it's a good way of doing that. I guess I didn't even think about it, but improving the visual scanning and the stimulation, as you stated.
Yeah, and I think, from a research standpoint, moving forward, we've, I don't know how it would work in a collision sport like rugby, but we're in the process of starting to trial it potentially in basketball, but using a lot of the the eye tracking technology, so wearing the glasses that track gaze behavior in athletes to see where they focus their attention in these agility-based scenarios. I don't know if they have glasses that are robust enough to handle a tackle-based situation in rugby, but yeah, understanding, I think, what they look at, where their scanning is, what they're anticipating, can go a long way to then improving technique and ultimately safety in these tackle-based situations.
Well, again, thank you so very much for joining us. I think we're gonna have to conclude.
Yeah.
But again, I'm so glad that we were able to finally link up, and we'll definitely continue our relationship and future discussion on the topics we brought up.
I love it. And then if anybody wants to get in contact with me, please feel free to. Shoot me an email. We can set up a Zoom. I was actually supposed to be in the US right now, but maybe next time in the US, hopefully in 12 months, we can catch up, go from there.
Don't ask for too much. I might have a whole bunch of pirates that just leave the States and join you down there. Keep it up.
That's all good. We'll take all the students we can get. All right, everyone. Thank you. I'll talk to you later. Thanks again.
Thank you so much, Dr. Talpey, and thank you, everyone. So Dr. Talpey signed off. Sam, did you? Sorry, Megan.
Yes. So thank you to Dr. Talpey for speaking today.